Welcome everyone to Healthcare for All, brought to you by WCANradio.com. This program examines the issues of healthcare for you. Join us now in the studio where the program is in progress.
Welcome to Healthcare for All, sponsored by WCAN Radio and produced by Span, Ohio. I'm Debbie Silverstein, your host, and I'm in the WCAN studio with my co-host Eric Meadows. Hi, Eric.
Hi, how is everybody doing? First off, I'd like to give thanks to both of you and our listeners for having put up with my absence. I did have to deal with a family emergency. I especially want to give thanks to Tim Simber for sitting in, during that time of absence. And I guess it's been, a month and a half.
A couple months, Eric.
Yeah.
It's been a couple months. I've really missed you, and it's good to have you back.
Oh, it's good to be back.
I missed your banter.
One of the things I do want to say is that healthcare is, in fact, a big issue. It's an extremely big issue, and it's coming to the forefront, and it's about time. I believe that politics itself has really taken a hard look at it because they know that the economy that the country is in right now, somebody is going to have to pick up the bill. Mm-hmm. And they know that the American public can no longer do it.
Well, actually, I think what we're seeing in some of these things is we're seeing cost shifting to the individual.
Yes.
And a lot of what is happening right now with higher deductibles, higher co-pays, and asking the individuals to pick up more of the premium costs. It's too expensive for employers, and it's too expensive for individuals. So something's got to break here eventually.
Something will eventually break, yes.
And there are solutions out there. And our guest tonight has some wonderful ideas and some wonderful solutions and experiences. Our guest tonight is T.R. Reid, a very well-known reporter and journalist. He's done documentary films, he's reported for the Washington Post, and he's done commentary on NPR's Morning Edition. T.R. Reid is probably best known for his documentary Sick Around the World, and that came from his 2009 book, The Healing of America, which became a national bestseller. And it's also now out in paperback. And so that inspired Sick Around the World and India, A Second Opinion. And he also has done another documentary that we're going to talk about tonight, which is the U.S. Healthcare, The Good News. And there is some good news that he has found for us. So we're very happy to welcome T.R. Reid.
Hi, Debbie.
Hi.
Great to be on your air. Thank you for having me.
Oh, we're very excited. Thank you for being a guest. So why don't you tell us a little bit about the Healing of America?
I worked for the Washington Post for years. As you said, I was a foreign correspondent. I never got along very well with the bosses. And so I hit on this scheme that I'd move out of the office, and I moved 10,000 miles away. And that worked pretty well for me. I developed this career rule: never work within 12 time zones of the boss.
Oh.
that was a good rule because they never called me. When I was working, they were asleep. I like that.
Oh, yeah, that would work.
So we lived in Asia, we lived in Europe, and my family, we enjoyed it. It makes your family closer. If you're in some foreign country, you need each other more.
Right.
I always felt it made us better Americans. We appreciated America more, having lived overseas.
Well,
and here's what happened. My kids broke their ankles. We got measles. We got sick now and then, and we started using the healthcare systems in these other countries. And we began to realize, my wife and I, that we were getting fabulous care, certainly an American level of care, fine facilities. We didn't have to wait very long. And the fees were minute. They were 1/5, 1/12 as much as we would pay in America. A lot of times, I didn't even bother sending it into the insurance company because it was so cheap to go to the doctor. So
really,
I just got interested in this question: how do you do that? How can they provide such good care for much lower prices? And I started reporting that, and I found even something more amazing, I thought, which is all the other countries like us, and I mean, advanced, high-tech, free market democracies, all of them provide health care for everybody. They cover everybody with high-quality care, and yet they spend, on average, about half as much as we do or less on health care. So I set out, just as a reporter, to figure out, how do you do this? How do you cover everybody in your country and spend far less than we do, even though we leave 50 million people without coverage? And that was my book, The Healing of America. And while I was writing that book, I made those 2 films you mentioned for PBS Frontline.
Mm-hmm.
And, and that's where it came from. And in some ways, my book is fairly critical of the United States. I mean, the fact is, the French, the Germans, the Brits, the Canadians are just doing a better job on health care than we are.
Right.
But I think my book turned out to be pretty optimistic because I concluded we could do it too. We could definitely cover everybody and spend a lot less.
Well, how would we do that?
Well, there are several approaches. You know, Americans think you go overseas and healthcare is all socialized medicine, right? It's all big government.
Right.
This turns out not to be true. Some countries do it that way. Some countries, the doctors work for the government owns the hospitals. That would be, you know, Britain, Scandinavia, Spain, Italy.
Mm-hmm.
But there are other countries that cover everybody with private doctors, private hospitals, and private insurance. In fact, several rich democracies have less government health care than we do. You know, you go to Germany,
Mm-hmm.
they don't have a Medicare. In America, when you turn 65, you go on a government insurance plan, Medicare.
Right.
In Germany, they stay with the private insurer, cradle to grave.
Oh, really?
They don't have a Medicaid for poor people. The government subsidizes private insurance for people to buy private insurance. So less government involvement than the U.S. has. And then there are some countries like Canada, Taiwan that are kind of in between. They have private doctors and hospitals, but a public payment scheme, which is kind of like our Medicare, you know, that government insurance to pay private doctors.
Mm-hmm. Well, Medicare is a pretty popular program here in the United States.
Yeah, it has the highest rate of satisfaction, and
Mm-hmm.
interestingly, it's the most efficient.
Well, then,
Medicare's administrative costs run about 3 or 4%. Private
Mm-hmm.
insurance companies are at 20 to 30%.
well, if it you know, I would think if it has the highest satisfaction, what is standing in the way from just extending that to everybody?
You want to know the secret, Debbie?
What?
It's a government program. It's a government program, and Americans don't like the idea of government providing their health care, even though when government does provide their health care, they really like it.
Well, Tom, I have a question to ask then. You're saying that Americans don't like the government administering their health care, yet at the high cost of what we're paying, you know, both in premiums as well as co-pays, Americans are willing to go broke to keep government out of health care?
You know, people ask me quite often, what are we paying for to these private insurance companies? As I said, their administrative costs are about 20 to 25%. It's like adding a 25% tax to every doctor bill they pay.
Mm-hmm.
So what do we get for it? Well, you get the satisfaction of knowing that you're getting health insurance from a private company, because I don't, it's really hard to see what else you get. If you ask the insurance companies, and I've done this, what do we get for that 20% administrative cost you add on? They say, well, we're trying to control costs and we're trying to get everybody covered.
Mm-hmm.
And if that's their goal, they've totally failed. You know, costs have gone up triple the rate of inflation for the last 20 years, and we have 50 million people without insurance. So, yeah, I don't quite get it. The Americans tend to believe, we learn in school, that the private sector can do most stuff better than government, right? And, you know, if it's about making cell phones or making cars, I think probably the private sector's better. But it just turns out in healthcare that has not been the case.
Well,
In healthcare, the private insurers are less efficient and higher payers than the government is.
Well, there's a difference between healthcare and other commercial products, things that you would buy on the market. You know, when you go in to buy a car, it's a little bit different than when you have acute appendicitis.
Absolutely right. For one thing, healthcare is life and death.
Mm-hmm.
And for another thing, the prices go up very fast and dramatically high, so that, you know, if you just stumble on the street, the
Mm-hmm.
bill for that can be more than a year's pay. And you really don't have any control over it. So, yeah, healthcare is just a different service and commodity from other things we buy.
But we've also found that in other cases, things, commodities that are for the public good, such as our roads, our fire departments, our police departments, our defense, that those are better done. Well, maybe not the defense department. There's a lot of waste there. But, police, fire, schools, roads are just better done when they're for the public good, when they're done by the public.
Yeah, let me think about that for a minute. I think that's often the case, but there are some things, like amusement parks are generally run by private companies, and they're pretty successful. I live in Colorado, and our ski areas are private businesses, although they're on public land, and they're pretty successful. So there's certainly areas where the private sector can do a decent, efficient job of providing a service at a reasonable price, but that has not been the case in healthcare.
Right.
If I can just be a little facetious here, I'm listening to the both of you talk about the healthcare industry as far as insurance companies administering it. And I got to tell you, they've done a good job of selling a bill of goods that really doesn't, hold much water in it. They've sold the healthcare package, as it can be called, without providing the actual healthcare that needs to be given to the public. And they keep doing this at a higher rate, and it continues to go up. So actually, they've done very well at selling the package. They just haven't provided the services should go along with it. Am I right or wrong on that?
No, I tend to agree with that. I keep asking insurance executives, what's the point? The American health insurance executives, if you run a health insurance company, you make $25-30 million a year. They make oil company payrolls. United Health had more than 100 people last year who were paid $1 million or more.
Wow.
So they make 10, 15 times as much as an executive of an insurance company, say, in Germany would make, or Japan. And yet they're the least efficient payers. They have administrative costs 10 times as high as their foreign counterparts. So they're getting a lot of money. They're not really performing on an international level equal to the other companies in other countries. So I don't quite get it either.
Well, what you're getting for that 20, 25, 30% is you're getting very well-paid CEOs and high-level executives, and you are getting richer shareholders. But they can't tell you that that's what you're getting because
you know something.
You didn't purchase the policy for that reason.
Right. Also, like you said in the beginning, Americans are happy to know that I've got health insurance, even if it doesn't hold much water to it.
Well, but they're becoming more and more unhappy. When I go out and I talk to people, there are people that their medications aren't being covered anymore. For example, Crestor's been dropped by a lot of the prescription insurances. And for some people, that's the only cholesterol drug that works. They've tried the others, they don't work. So now they're shelling out of pocket for this.
Wow.
And that type.
Yeah, and I think that is a pattern in American healthcare. More of the cost is being shifted to the patient, the consumer. And I kind of don't blame the insurance companies for that. It's their suppliers, the docs and hospitals. Their prices are going up.
Right.
Interestingly, the lowest payer of doctors and hospitals is the government. Medicare has much better fees, that it's lower fees for the same service than private insurance pays, even though private insurers often have more customers. So it's just another question. Why can't the private sector get the same bargain rates that Medicare can?
But when you're talking about the private sector, you're talking about all these different insurance companies. You're talking about Aetna, you're talking about WellPoint, you're talking about United Health, you're talking about Cigna. And when you're talking about Medicare, you're talking about one entity that goes nationwide.
Yeah, and it uses its market power that way.
Right.
Whereas, United Health or Aetna, they operate in 45 states, but each state is a different company.
Right.
And therefore, they don't have the market clout that Medicare would have. And it's been suggested to them, why don't you use, United Health advertises on TV 70 million customers. That's almost twice as much as Medicare.
Right.
But yet they pay much higher fees. And it's been suggested to them, why don't you use your market power to get better rates, and then you can lower premiums to your customers. And they have many reasons why they can't do that. That doesn't seem to work.
Well, you know, one of the things, one of the questions I wanted to ask you is, when you're talking about some of the other countries that rely on private insurance, and you mentioned Germany, doesn't Switzerland also?
Yeah, Switzerland uses the German model. Japan is primarily private insurance. In France, everybody has a government plan covering basics, and then everybody has a separate private insurer, kind of like the supplemental plans that Medicare patients buy in America. So yeah, many countries rely on private insurance, and the striking thing about it is, in all the other countries that have private insurance, there are regulations that make the insurance work better. For example, in all the other countries with private insurance, the insurer has to pay every claim. They can't deny your claim. And I bet you a lot of people listening to this show have had a health care claim denied. I certainly have.
Yeah, I have
too. In other
too.
countries, they can't do that. You know, in America, the insurance companies have this in-network, out-network business.
Right.
They pick certain doctors, and if you want to go to some other doctor, you pay 6 times as much. In the other countries, Germany, Switzerland, you pick the doctor, you pick the chiropractor, you pick the hospital, and insurance has to pay. They can't do this in-network, out-network. And get this, in most of the other countries, insurance has to pay your claim within 3 days.
Wow.
In Switzerland, if the insurance company doesn't pay the claim within 5 days, your next month's premium is free. Now, anybody in Ohio have that deal?
Not at all.
No,
nobody has that deal. So private insurance can work and works fine if it's regulated. But American insurers have the lobbying clout to resist that kind of regulation, and so it just doesn't work as well here as it does in the other countries.
Well, Tom, if we, let's say, all came together and agreed that this is how we're going to do it, which country out there actually is going to present us with the best template that we could follow, and how long would it take to implement something like this?
Yeah, I'm talking about my contention has been, the most important thing is to cover everybody. If you cover everybody, obviously it saves lives, it avoids pain and suffering, and it cuts costs. The countries that cover everybody, on average, spend half as much as we do, and it's not a coincidence. If you cover everybody, overall costs go down. So I think a lot of countries are doing it, but the ones probably closest to us, the German model, because they rely on private doctors, private hospitals, and private insurers. The Japanese model is a little closer to ours in that it's private insurer. You split the cost of the insurance with your employer. The docs and hospitals are private, and then when you retire from work, you go on a government plan. It's sort of like our Medicare. So any of those we could import, and we could do it fairly quickly. The real problem, Eric, is the political power of the insurance companies. They have been able to resist the kind of regulation you see in other countries. And as long as they have that political clout in Washington, it's going to be hard to get there.
Okay.
Well, now there is some good news in healthcare in the U.S.
Yes. We made a movie about it.
Yeah. And, you know, there's some really interesting one. I want to start with Grand Junction, Colorado.
Yeah. So what happened in this movie is PBS came to me after we made those other movies and said, why don't you make a movie called U.S. Healthcare, The Good News? I thought it was kind of an ironic title, but it turns out, as you said earlier, Debbie, there is good news. And basically the news is that all over the country, there are places, communities providing very good care at costs that are way below the national average. And one of the ones that's in our PBS film is Grand Junction, Colorado. This is an oil town on the western border of Colorado, where Colorado and Utah meet. And the doctors there got together and came up with a system where just about everybody in town is covered, and cost costs are about half the national average, way below the national average. I'll give you some numbers here. On average, Medicare pays for the average senior. They pay about $8,800 a year for the average senior.
Okay.
But there's some communities like Miami-Dade County, Florida, $17,000 a year, twice the national average. Grand Junction, Colorado is spending about $7,000 a year per Medicare patient. That's way under the national average. And guess what? Their outcomes are better than Miami-Dade. They have better health results. So,
well, why is Miami-Dade so way out of line? They're more than double.
Yeah, well, for one thing, a lot of old people have moved there, so they're sicker, but that's not really the reason. The reason is they have a medical culture there where the doctors are constantly referring patients to their buddies and to each other and to the hospital and back to the patients. They do more tests, they do more exams, they do more prescriptions than other places. They just churn a lot more business, and the insurers pay those bills. If the doctor says this is necessary, they pay the bill. And just recently, when we made this film, Medicare particularly, and some insurers started saying, wait a minute, why do we have to do 3 times as many tests in Miami as we do in Colorado when the people in Colorado are healthier?
That would be my question if I was paying the bill.
Yeah, that's a good question, and it's taken quite a while for the insurers to figure this out. The important tool is a big, thick book called the Dartmouth Atlas of Healthcare. This is prepared at Dartmouth College in New Hampshire. And what they did is they took hundreds of millions of Medicare billing records. Medicare records are public. They black out the patient's name, but the diagnosis, the treatment, and the price are public records. And so they just went through millions and millions of them, and they came up with this atlas, this map that shows which communities are low cost and which are high cost. And strikingly, many of the very low-cost communities have the best health outcomes.
Wow. So what's Grand Junction's secret?
I think Grand Junction's secret is the doctors got together and decided to do this. And nowadays, if any doctor, young doctor, thinks of moving to that community, the existing docs say to him, hey, come on in, we'd love to have you, but here's our system, and here's how their system works. They take all the payment from all the different insurers, from Aetna, from Blue Cross, from United Health, from Medicare, from Medicaid, all of them. And instead of each doctor getting a separate bill for each procedure, they pool all that money, and they've agreed to one price for the same procedure, regardless of who the payer is. And then they withhold, when they pay the doctor, they hold back 20% of the fee, and at the end of the year, they pay the remaining 20% sort of as a bonus to the docs who have had the best results at the lowest cost. So there's a strong performance incentive built into that system. And it's voluntary. You know, the docs don't have to take part, but nowadays when a doctor moves to town, the other doctors kind of take her over to the country club and say, look, doctor, you're going to do this, or you're not going to be happy, you're not going to fit in here. And now, you know, this system was reported in the New Yorker. I made a film about it for PBS, and so now doctors show up in that town wanting to join the system. They want to be part of the system because they know it works.
All right, now the better benefits or the better health outcomes that they're noticing in Grand Junction, part of that is because now that everybody has equal access.
Yes, I think that's very important. One problem that is very common around America is, in fact, it happens about 30,000 times a year all over America. A woman shows up in the emergency room, 9 months pregnant, 7 centimeters dilated, ready to give birth in the emergency room, and she's never seen a doctor, never had any prenatal care, because in most states, if you don't have a child yet, you don't qualify for Medicaid, so they can't get any care. In Grand Junction, they made a rule: if you're pregnant, we'll care for you. We don't care if you're insured or not. We don't care who your insurer is. We're going to give you prenatal care. And one result is much healthier babies and a much lower rate of neonatal mortality than in the rest of the country because they're providing care to everybody.
Was it the doctors that came and put this think tank together so that they could come up with this solution?
Yeah, the doctors. So here's what happens. I don't know if you know this, but, you know, in America, unlike other countries, the same procedure in the same hospital gets a different fee depending on who the payer is. Like in Colorado, for example, if your child has an earache, they call it otitis media. An insurance company will pay about $88 for that office visit. Medicaid in Colorado pays $28 for the office. Same office visit, same treatment. And one result is quite often when the Medicaid patient calls up, the doctor says, oh, my schedule is full, I can't fit you in. And so a lot of Medicaid patients don't get as much care as they ought to. And the doctors in Grand Junction didn't like this. And that's why they came up with this scheme where they all take the same fee for the same service. And that way everybody can get a doctor's appointment. And that's where it came from. It came from the doctors wanting to treat everybody in their community.
Well, you know, we've often heard about the Medicaid patients that abuse the ER. And we had an ER physician on the show a couple months ago who said, well, they have no place else to go. And,
no, that's absolutely right, yeah.
And when you're talking about this and how hard it is for them to get an appointment, one of the latest trends is for hospitals to buy up physician practices.
Yeah.
And then the physician works for the hospital.
Yeah.
And here in Ohio, in Cleveland, there's a very well-known hospital system that does not allow their primary care doctors to take Medicaid patients at all.
Yeah, well, that's, A, it's regrettable, but B, it's kind of stupid for a hospital because, you know, we're not awful people in this country. If somebody gets hit by a truck or something, we're not going to let them bleed to death on the street, even if they don't have insurance. And so the way we've decided to deal with it is, you go to the hospital, and if you're sick enough to go to the emergency room, they have to treat you, even if you can't pay. So the hospitals get stuck, and any hospital in America will tell you they do, you know, 60, 80, $100 million of uncompensated care every year. And therefore they should take the Medicaid patient because they get paid something. They're not happy with the Medicaid rate of pay, but it's better than zero. So if a hospital is saying we're not going to take Medicaid patients, you know, they're going to end up seeing those people eventually in the emergency room, which is the most expensive way to provide care. I always say, you know, why don't you shut down the city bus service and just give everybody a chauffeured Rolls Royce to work? Because that's what we do when we treat people in the emergency room. We treat them in the most expensive possible way.
So, well, that answers another question I had. When we're talking about universal coverage and it's saving money, you know, and why is universal coverage better than what we do with Medicaid? Because some of the poor get coverage through Medicaid, and many states were still fighting over a Medicaid expansion under the ACA. And for those that can't get the Medicaid, there's always the charity care that's provided. We don't throw them out on the sidewalk, you know.
That's right. But
that type of thing.
If you don't have insurance, it's hard to get treated until you're sick enough to go to the emergency room.
Right.
And then it gets very expensive. So I'll give you an example. I learned this when I was living in Britain. You know, somebody who is a maid in a hotel or a clerk at the 7-Eleven, you know, would not be insured in America.
Right.
Feels kind of a vague pain down on the right side of her abdomen, and you know, it would cost $100 to go to the doctor. She doesn't have insurance. She just has to live with it. And of course, what happens is 4 weeks later, her appendix bursts. She goes to the emergency room, and that's a $130,000 procedure.
Wow.
If she had gone to the doctor when she first felt that pain, it would have been about $130, and we could have staved it off. So treating people early saves tons of money in the healthcare system, and because we don't provide that, we end up paying vastly more and having a lot more suffering along the way.
So instead of the bus token, we're doing the Rolls Royce.
That's how we end up doing it, and nobody would choose to do that, but that's the way we've done it. I mean, another option would be, hey, if you're sick, just sit out on the grass and die, but we're not that kind of people. We're not going to let that happen.
No, we're not.
And so we've chosen to stick this job on the emergency room, which is, frankly, just not a very wise way to do it.
Yeah. Yeah, and I think you're right. We're not that kind of a country. We're not that kind of a culture or society. Despite what we saw during some of the presidential debates last year when people said, let them die, that's a very...
Yeah, but that was one or two people. That's not most Americans.
That's a very small minority of people.
Yeah,
Unfortunately,
right, yeah.
It got a lot of attention. The vast majority of us, and this is something that I heard you say one time, was, when people are asked if healthcare is a right, that they're hesitant on that. But if you ask, does a government have an obligation to care for all of its citizens when they're ill, that people responded favorably to that. That yes.
Yeah, that's interesting. So if you ask, and I did ask when I did my book, if you ask in the other rich democracies, why do you provide health care to everybody? They quite commonly say, well, health care is a right, If you have a right to life, liberty, and the pursuit of happiness, you can't have life unless you have health care when you're sick. They see it as a right, but I find quite often, if you say to Americans, well, there's a human right to health care, a lot of Americans think, God, we got enough rights already. I'm spending too much on other people's rights, leave me alone. So they don't like that formulation. But then, interestingly, as you said, if you say the same thing in a different way, I have an obligation to see to it that my neighbors get health care when they're sick. Yeah, almost all Americans agree with that.
That is interesting.
It is extremely interesting.
So I've stopped using the argument everybody has a right to health care, and I use instead a decent, compassionate, ethical democracy should provide health care to everyone who needs it. And boy, Americans, they accept that. They like that.
Well, I'd be willing to say that more than 80% of Americans are going to agree with the conversation that's going on, regardless of what side of the field you're on, whether you're in politics or just the average Joe. Why then are we then stuck with these high costs? If everybody can come to this reasonable, understanding, why then are we still stuck here?
There are a couple of reasons. One is, I've concluded, I've given talks about this all over the country, and I think Americans don't know how cruel our system is. In fact, quite often, I don't know if you know this, but the National Academy of Sciences says that about 22,000 Americans die every year of treatable diseases because they couldn't afford a doctor. That's, every year, that's 7 times as many as died on 9/11. And when you say that, many Americans say, no, that's not true. Yeah, I don't buy that number. You made that number up. It comes from the National Academy of Sciences. Nobody made it up. It was a study done during the Bush administration, so it's not political or anything. It's a fact. And but Americans don't believe it. It doesn't sound right. We're not that kind of people. In fact, we are. That is happening in our country. But Americans don't want it to happen. And, they're looking for a way to fix it, I think. So there's that. I think one of the major reasons costs are much higher in America is because these are market pressures. The payers are fragmented. There are many, many different payers, and in many communities, there's only 1 or 2 hospitals, and so the hospitals have the pricing power. They can set these prices, and the payers, the insurers, or the patients are kind of stuck. There are just too many of them. They don't have market power. The one that has market power is Medicare, and that's why Medicare pays 1/5 or 1/8 as much for the same procedure in the same hospital. And I have often said to insurance companies, why don't you just tell them you'll pay the Medicare rate? And there are complicated reasons why they don't do that. But if we could, there are about 49 million Americans on Medicare now. If we doubled that number or tripled that number, put more people on Medicare would have even more bargaining power, and could get prices even lower. So I think that would be a way to get us to where we want to go. If, for example, if you extended Medicare, said Medicare starts at 60 instead of 65, and 5 years later, say it starts at 55, eventually we'd get to 150 or 200 million Americans on Medicare. And then Medicare could use its bargaining clout to set prices for everybody.
Well, wasn't that the original intent with Medicare, was to lower the age until eventually everyone was covered?
Yes. President Lyndon Johnson and his health secretary, Wilbur Cohen, when they started Medicare in 1965, they set it at age 65 because that was the Social Security age at that time. And Johnson's plan was 5 years from now, we'll reduce it to 60, then 55, then 50, then 45. And had that happened, all Americans would be covered today. We wouldn't have the problem we have today, and we'd have much lower prices. But it didn't happen for various reasons. It didn't happen partly because Medicare is a government program, and a lot of Americans, don't want government getting between them and their doctor. And
they'd rather have an insurance executive.
Yeah, exactly. Had we done that, we'd all be covered today. And I think, particularly, you've seen these recent stories about crazy hospital prices, and in the same town, the same procedure costs 10 times as much. In all those stories, the striking thing is the lowest payer in every case is Medicare.
Right.
And guess what? 99.5% of all hospitals in America take Medicare. They can't say no.
Exactly.
And so if we expanded Medicare, people like the coverage. People are pretty satisfied with Medicare coverage, and they'd have more bargaining power. I think it would give us better control over prices. And Medicare also does a lot of quality work. I mean, they keep sharp track of the care that their patients get. So I think that would be a step in the right direction if we expanded access to Medicare.
How much effect do you think the Affordable Care Act is going to have on the problems that we have in our healthcare system?
Well, on the one hand, it's the biggest change in a health policy in America since Medicare, so in some more than 50 years. And it's designed to get about, of the 50 million uninsured, it's designed to get about 30 million of them covered, either through private insurance or through Medicaid. And that's a good thing. If we can get 30 more million Americans to have insurance so they go to the doctor early, they get their ailments treated, that's a good thing. So a lot of good stuff in Obamacare. On the other hand, according to the White House, when it takes full effect in 2017, there'll still be 25 million Americans without health insurance. It doesn't do anything to ease the complexity, and it does not very much to control costs. So it's not the solution. It's a solution. It's going to be better, but it's not the answer we need.
What answer do we need?
We need to make a commitment, and I think it's a moral commitment, to cover every American. We need to say, doggone it, if you live in this rich democracy and you need a doctor, we're going to see to it that you're covered. And we've never done that. We've never done that in this country. And as I say, even Obamacare is going to leave 25 million people without insurance coverage. So that's the first step. And then the question is, well, how do we get there? One way to get there would be through some national program. I think another possibility is state-by-state programs. Like, for example, it happened in Massachusetts, as Mitt Romney always said. They have 98.5% of the people in Massachusetts have health insurance. And their costs have gone up, but their costs have gone up less than the costs in, say, Illinois, Wisconsin, or Colorado, where I live.
But one of the things that hasn't gone down there is their bankruptcy rates due to medical debt.
Yeah, isn't that striking?
Yeah.
How can that be? I don't quite get that.
Well, part of it is because most of the policies sold on the Massachusetts connector were bare bones policies. With high deductibles.
Yeah, and if you have a bare bones policy, you can still, if you happen to get hit by a truck, you can lose everything.
I could go bankrupt easily with the policy that I have.
Could you? Yeah.
Yeah,
so,
and it's only going to get worse.
Of the Americans who have insurance, about 18 million have these so-called mini-med policies that really don't cover much, and they don't even kick in until you spent $5,000 out of pocket. So that's not very good coverage.
No, it's not. It's not. And and more people. I know two people that have had to resort to internet fundraising now, one with
Yeah, now that to me is, I mean, in the richest country in the world, come on, you have to have a bake sale so that your neighbor can get the insurance, the operation she needs.
and some of the people that had to resort to that were some of the victims of the Boston Marathon bombing. They were insured.
I saw that.
They were insured, but they still had to go to internet fundraising to cover their costs, which is, I mean, that's wrong in America. People yell personal responsibility. Well, how does personal responsibility enter into that equation? It doesn't. They were victims. And
yeah, totally. Yeah. So when I was in Germany, the health minister said to me, I mean, I was interviewing him, but he said, "Could I ask you a question? Is it true that people in America have to have a bake sale if they need an operation? How can that be? In America, I thought you were a rich country." He says, so, yeah, how can we let this happen?
Yeah.
Tom and Debbie, I know we're coming towards the end of the show, but to sum everything up, how then, and again, when will it, we implement a reasonable health care policy? Sure, Obamacare is a step in the right direction, but again, 25 million people still uncovered. When do we come to the understanding that everybody needs to be,
or how do we get to that point? What do we need to do as a country to make that happen?
Well, about 4 years ago, we were spending 14% of all our wealth on health care, one out of every $7 we spent. Now we're at 17.5%, so that's one out of every $6. In 4 years, we'll be at 20% if we have the current rate of growth. That'll be one out of every $5 we spend will be healthcare. Eventually, Americans aren't going to be able to afford to stay healthy. And at that point, I think we will say, okay, the time has come. We got to fix this.
So it's going to take the American people standing up and saying, we demand it.
I think it is. And one of the issues, of course, is there's so much money flowing to American politics, and a lot of it comes from insurance companies, drug companies, hospital companies that are pretty happy with the status quo. They're winning big in the current system, so they fight change.
Yeah, that's an unfortunate thing. Tom, we want to thank you very much for being a guest on Healthcare for All. You've been very enlightening, and I've totally enjoyed the conversation.
Debbie, thanks so much for having me on, Eric. Really good talking to you.
So,
quite welcome.
And we hope people will tune in again next month and listen when our guest will be Wendell Potter.
Oh, great.
I just want to say, until then, everyone, listen, stay as healthy as you possibly can. Look for the solution through Healthcare for All.
And join us in this. If you're in Ohio, please go to our website, www.spanohio.org, and sign up to help us out with this.
That's right. Until then, good night, everyone.
Thank you.